Alright, hello. And so right now I have a teddy bear as my help because my niece and nephew they cannot come because these questions they won't apply to them and it's a little bit too much for them. And so right now this is Vincent. He's a teddy bear. I got him from school. So I'm gonna act like he's a teenager, and we're gonna be asking questions regarding you know alcohol, sex, drugs, risks for STDs, and preventing STDs. Okay. So how you doing, Vincent? My name is Timothy Doria. I'm gonna be your nurse today, and I just want to let you know that everything here is gonna be confidential. You know, I'm gonna get. I just need to sign this thing. Okay. So everything's here is signed. It's consented. This won't go out. To anybody else. This is confidential. It's just me and you. Okay. Okay. So these first, I'd say like 8 questions. I mean, 4 questions really, but it's really 8. But like, okay. So have you ever felt you should consider, you know, cutting down on like drinking or alcohol? Yes or no? Yes. Okay. Good. Okay. Have people annoyed you by by criticizing your drinking or like your drug abuse. I mean, use. Sorry. All right. Um, have you ever felt bad or guilty about like your drinking or like your drug use? Have you ever had a drink or taken a drug first thing in the morning? To like steady or calm your nerves and or to get rid of like a hangover. It's like an eye opener. Like when you get a drink, it opens up your eyes. Gets you going. Yes, no. Okay. So those are the questions for alcohol and drugs. That was via the cage. Okay. All right. So now we're gonna switch it up to like sex. Okay. So, have you ever been sexually active in the last year? If no, have you ever been sexually active? Any? Yes, you have been sexually active. Okay. So, do you have sex with men, women, both? I don't judge. We're all human beings. We love who we love. Okay. How many sexual partners have you had? In the past like 12 months, or like in general, have you know? Okay. What do you consider yourself to be like? Do you consider yourself to be like lesbian? Like gay, or do you consider yourself to be straight? Heterosexual, or do you consider yourself to be bi? You can like men or women. You know, um, what is your current gender like gender identity? Like, are you male? Are you female? Are you other? You know. Um. All right. Uh. What sex were you assigned at birth? Like as shown as like in your like original birth certificate. Male, female, or you just don't want to answer. It's fine. You know. Um. What questions do you have about your body or sex? It's you're a teenager, and you may be going through some stuff. Maybe you're growing. You're growing up. You're a teenager. You experience things that maybe you may think that like, oh, it's weird, but it's normal. Everyone goes through it. I went through it. Personally, your body changes. You can get bigger. You can get you can grow facial hair. It's different for everybody. All right. Um, your body changes a lot during adolescence, which I just said. And although normal, it can be very confusing, you know. Some patients, you know, since I'm a nurse, some patients may feel as they are more of a boy or a girl in another way. Like, let's say, like, for me, maybe like when I was growing up, I was maybe leaning towards more of a girlier side, you know. So like, um, I may have acted different, you know. Like, how has this been for you? Like, are you more leaning towards like the more male side or the more female side? Which it's normal, you know. Everyone goes through it. It's fine, you know. You just have to explore, you know, yourself and learn more about, you know, yourself. And some people your age are exploring, uh, you know, relationships. Like, how do you find yourself like attracted to? Like, who do you find yourself attracted to? You find yourself attracted to men, you know, in that approach, or you find yourself attracted to more females, or you could be both, you know. It's all about exploring, you know. You're a teenager and you go through some stuff, which is totally normal. All right. Have you ever had sex with someone? And by sex, I mean like vaginal sex, oral sex, or anal sex, you know? And I just want to know. Because you're a teenager, you know? You go exploring, and, you know, you never know. Have you ever been coerced, you know, or pressured, you know, to have sex by like another individual? You know, you don't want to go into situations where they are forcing you to, but everybody has an option. Everyone has a choice. Have you ever had an STI or sexually transmitted infection or disease? Uh, I just want to know because if you did have sex, you know, always use a condom. Always ask before having sex. Ask, do they have an STD or an STI? It's important because you want to protect yourself and them. Because if they do, or if you don't know, you could always get tested. You know, it's always the better and safe approach. But you could also stay abstinent, which is no sex at all. You know, you have 0% of getting any, you know, sexually transmitted disease. You're basically sex free. Um, what and when do you use protection? So like maybe like do you always have like a condom on you? Does she have a condom? You know, always carry a condom, you because you never know. Because if let's say like a situation arises, you have to be safe. You know, always carry a condom like in your wallet or like in your back pocket. You always have to be safe. You know, protection it goes a long way. Um, yeah, so like condoms, they help you prevent STDs, you know, and complete abstinence is the best way to prevent STDs. And it's very, very, very important to talk to your partners about STDs before having sex. You know, communication is key. So like you may or may not know that some STDs include chlamydia, gonorrhea, syphilis, herpes zoster, HPV, HIV, and trichomonas. So like some of these STDs are incurable, some are curable, and some are fatal. Some can make it difficult for your partner to get pregnant or make it impossible for them to have a baby. So you always, 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 if you are going to, you know, have intercourse or have sex with another individual, please always use protection. Protection is very important, you know, because women they are most uh, susceptible, vulnerable to getting STDs rather than men. So you always have to think about the other person, think about you, think about your family. You know, STDs are very dangerous. Sex, sex, yes, it may be fun, but you have to be safe. You always have to be safe. You can't put someone at risk knowing that these diseases are here. So thank you for your time, and everything here is confidential. We're not gonna tell your mom. You know, your mom doesn't have to know. Dad doesn't have to know. You know, it's between you and me. It's confidential. But if you have a feeling, you know, if you do have sex, and you feel like a burning or anything, you could always come to, you know, the clinic or like a hospital or like your primary care provider, and they could always screen you. You know, if you're scared, you know, you may have like STD. You know, you may be out on somebody. Just check. You know, it won't hurt. You know, even though there's like you may be scared. You know, it won't hurt. You know, it's for your own health. Okay. All right. Thank you.